Risk factors for heart disease vary from men to women, but what we call the traditional risk factors, which are risk factors that affect both men and women, are high blood pressure, high cholesterol, diabetes, smoking, and obesity. There are also gender-specific risk factors that affect women particularly, and those are all the traditional risk factors we just spoke about, but also cardiovascular complications of pregnancy, which include any of the hypertensive disorders such as gestational hypertension or preeclampsia, gestational diabetes, peripartum cardiomyopathy. In addition, anxiety, depression, and autoimmune disorders are all increased risk factors for women. Prevention is really key for heart disease, so it's very important that everyone know their numbers. And when we say know your numbers, it's not just checking your blood pressure at home, but it's also making sure that you're being seen annually by either your primary care physician, provider, or again a cardiologist if you have one, so that every year your blood pressure is being checked, your cholesterol is being checked, your A1C is being checked. It's also a nice way that we can ensure that you're on all the right medications, talk about heart-healthy diet and exercise. So knowing your numbers is key, and making sure that someone is tracking that yearly is very important, because again, prevention is our number one tool in the fight against heart disease. The best way to decrease cardiovascular risk, again, is to know your risk factors and then work on mitigating those risk factors. So if, let's say, someone has high blood pressure, ensuring really good blood pressure control. And ideally, that's a blood pressure of less than 120 over 80. So those numbers have gotten a lot tighter and stricter in the more recent years. Additionally, it's excellent cholesterol control, being on cholesterol medication if appropriate, and really good glucose control, again, a really tight, good A1C. Additionally, heart-healthy diet and exercise. You know, we say this all the time, and I'm sure we sometimes sound like broken records, but really a good heart-healthy diet and exercise really do help mitigate risk and help improve cardiovascular health.